Hi, this is Frank with a frank opinion. I'm not wearing my glasses today purposely because I'm in a fighting mood. The late George Carlin, a genius in my opinion, in a famous monologue, observed correctly that the corporate sector basically don't care about you. And he went on to say that it's not in their interest to have a population that's capable of critical thinking, a well-informed, educated citizenry capable of critical thinking. I watched 10.5 hours of the hearings of the Rules Committee, Budget Committee, and Ways and Means Committee, instigated by Jayaapal's Medicare-for-all for 2019 Bill 1384 in the House. So these are Democratic House-controlled committee meetings, supposedly historic, dedicated to talking about effectively and thoroughly one of the most important issues that we face today in the United States and have faced for decades. And I must tell you that those 3 committee meetings, in my opinion, were a complete disrespect to us as Americans. In terms of the panel, not one person there representing the economic side for the Democrats was able to refute the misinformation and, in fact, lies of the Republican representatives on the committees in terms of witnesses: Charles Blehaus from the Mercatus Institute, Grace Marie Turner from the Gehling Institute, both small, in parentheses, tiny government, libertarian/conservative arms that were there to talk about the Mercatus study, Charles Blehaus' study, among other things, suggesting, which is not in the report, that it would cost an additional $32 trillion on top of what the federal government is spending now to implement Medicare for all. Misinformation, absolutely not true. But it took 6.5 hours, 6.5 hours of these hearings. Several times my head was going to explode for a Democratic House representative who became my hero in terms of the congressional representatives on the Democratic side, absolute hero, Virginia Congressman Bobby Scott. 6.5 hours in part of the Budget Committee hearing, refuted and clarified that the $32 trillion supposedly on top of what we're already spending now was not so, that it was in lieu of, that it was a total figure, 32 trillion, 3.2 trillion per year, would be able to implement Medicare for all. We're already spending $2 trillion a year on our health care in terms of federal expenditures. Virginia Congressman Bobby Scott did his homework. He cared enough. He prepared. Let me tell you some of the people that did not prepare. The only so-called economist of the 3 committee hearings, 10.5 hours, was Dean Baker, co-founder of the Center for Economic Policy and Research, who, probably because of his own arrogance, his own inflated ego, could not reference the tremendous work done by Dr. Gerald Friedman over the last 5 years, an economist from the University of Massachusetts Amherst that has studied the former bill H.R. 676, is a renowned expert on Medicare for all, has revised his work dating back to 2013 3 times, including his latest, which I have right here, The Case for Medicare for All, which I read February 2019. He should have been one of the witnesses. Robert Pollin, the leader of the PERI, the Political Economy Research Institute, also by coincidence at the University of Massachusetts at Amherst. They conducted a rigorous study, well over 200 pages. Here it is. I read this. He should have been on that panel. Independently, the work of Gerald Friedman and Robert Pollin's group basically coincide very well. And another person that might have been on that panel is, in my book, a giant, and I wish he was on the circuit for talking about the impact of our current non-system on businesses. That's Richard Master, who, because of his own frustration in terms of working to try to figure out how to keep up with increases in the premiums for health insurance for his personnel. He's a medium-sized business owner, not small, MCS Industries, located in Pennsylvania. Richard Master. He envisioned and developed a wonderful website loaded with videos, wonderfully done, and information on Medicare for All, and it's called Fix It Healthcare, fixithealthcare.com, and I'm going to reference that right now. So, interestingly enough, these people should have been, because they have studied Medicare for All backwards and forwards for years. They are the experts. Not the very tiny Mercatus large font report of 22 pages. These people did their homework. And even in terms of the type of misinformation that was given by the Republican representatives, Grace Marie Turner and Charles Blahous, Blahouse's own report, Mercatus, says Medicare for All would increase taxable worker wages net of employer-provided benefits, while also relieving individuals, families, and employers of the substantial health expenditures they would experience under current law. It would also relieve states of such Medicaid expenditure obligations as are transferred to the federal government. And he goes on and on. Benefits of implementing Medicare for All. What was the objection of Medicare for All? Not the cost. It was the fact that it would increase the role of federal government. So economics was fighting with ideology, small government. Get government out of, if you don't like government, leave. If you're a Republican Party that doesn't like government and what it can do for people, hey, do something else. I also want to say, in terms of the disrespect of not having these people on to be able to refute the misinformation on the Republican side, this is all basically because of the House leadership. I did my own, like Woodward and Bernstein here, trying to get, and did get, non-denial denials. So I happen to know pretty emphatically, and if we went to court, if anybody wanted to sue me, that the leadership of the Democratic Party did not want these committee meetings to succeed. They allowed the misinformation to occur for 10.5 hours. So when people laud Nancy Pelosi because she's able to bother the occupant in the White House, because she's able to get underneath his skin, gee, that's great, outmaneuver him. No, she's been there for 30 years. We've got 30 million Americans uninsured, between 40 and 85 million Americans underinsured. There are horror stories each and every day with regard to our health care. And these Democrats have been in there for 20, 25, 30 years and can't figure it out. Can't look at the 32 other countries that have managed to implement universal health care. Give me a break. James Madison kind of agreed with George Carlin. He said that the advancement and dispersion of knowledge is the only true guardian to our liberty. We've got to read. We've got to be willing to learn. So I'm going to give you 4 fabulous websites. Physicians for a National Health Program.org. PNHP.org. Nice, kind of very short. FixitHealthcare.com, the website produced by Richard Master, constantly adding information, and those videos are spectacular. Medicare-for-all.org, another wonderful website, and I believe that one is from National Nurses United. And BusinessInitiative.org, an outgrowth of FixitHealthcare.com that brings together, under the leadership of Wendell Potter, another person that might have been put as a witness on the Democratic side, BusinessInitiative.org, dealing with Medicare for all and the arguments for it and the support for it from the business side. Lastly, I'm 72. I am sick and tired of hearing that we're the greatest country on earth. Not while we have those little kids in the border in cages, not while we're allowing the bombing of Yemen, but let's deal with Medicare for all. This is 2019. 30 million uninsured Americans. Not undocumented immigrants. Americans, citizens. I don't know what year here is, but if we're ever going to really legitimately call ourselves greatest country on earth, we've got to get this down to zero. Zero. That's the only way we can claim that. Thank you.